I am Dr. Neeraj, MD Homeopathy, working as a Community Health Officer, National Health Mission, and also as a District Internal Assessor, NHSRC, NQAS, Telangana. I also have an experience of working with Dr. Jatin Walia sir as a sports physician for 5 years. Today, we will be dealing with study module sports injuries, and in sports injuries, we will be discussing sports injuries per se. So far we have discussed in the first topic, that was muscle physiology and biomechanics, and now in the second section of this sports injuries module, we will be dealing with sports injuries. Sports injuries, we all come across injuries during sports, yes or no? Yes, we do. So the objectives of this particular topic would be, we will be dealing with introduction, scope and understanding sports injuries, statistics of common sports injuries and its impact on athletes, types of sports injuries, acute, chronic, principles of injury management, followed by preventative measures, regional sports injuries, anatomically like head and neck injury, shoulder injury, and so on. And we'll be dealing with diagnostic tools, treatment options, and also return to play criteria, followed by the summary. Coming to introduction to importance of understanding sports injuries. Sports activities have been evolving ever since ages, and now sports play a major role in an athlete's life, as it can enhance the lifestyle of people who inculcate it in their life. Now, injury is nothing but tissue damage or other derangement of normal physical function due to participation in sports, resulting from rapid or repetitive transfer of kinetic energy. Sports injuries are a common occurrence for anyone participating in physical activities, from professional players to weekend warriors. They may occur during training or during the game itself. The impact of the injury may vary from a simple minor ailment to a gross severe injury, affecting the performance of the sports person. If you see in the stats of the common sports injuries, the most of the sports injuries happen in soccer, followed by basketball, then swimming, and then track and field like your running race and other sports, the track sports, followed by volleyball and other sports. So it is soccer which has seen the most number of sports injuries so far. Now let's look into the causes of sports injuries. The causes can be acute trauma like a sudden impact or fall, or it can have a chronic overuse injury, or it can be due to an inadequate warm-up or conditioning of the player, or it can be because of an improper training or an improper equipment. The performance of an athlete is affected by numerous factors and can be roughly grouped into 3 categories, which are physiological, biomechanical, and psychological factors. Now, all these factors play a major role while the player is performing. Any derangement in any of these 3 areas of concern, definitely the performance of the athlete would be at stake. Now, types of sports injuries. It is broadly classified into acute, chronic, and on-field injuries. Along with this, I have also put common injuries, which include sprains like ligament injuries, or then strains of the muscle and tendons, fractures, dislocations, contusions, tendinitis, and concussions. The common on-field sports injuries can be sprains and strains, fractures, dislocations, concussions, and overuse injuries like shin splints and tendinitis, which are often caused by sudden movements or repetitive actions. Now let's look into the biomechanics of sports injuries. Biomechanical factors have a profound effect on how the athlete performs and compensate the movement performance of the athlete. Biomechanical factors have a profound effect on how an athlete controls and compensates movement patterns during the performance of a movement or the series of movements. Now, these compensations often lead to faulty movement patterns which decrease the performance of the individual. For example, if a javelin thrower has an overactive infraspinatus muscle in the shoulder, it would significantly affect the thrower's ability to deliver a consistent high velocity throw. And this particular thing is applicable to other sports as well, like golf and tennis. So the movement of the athlete can be tracked by something called as video analysis software. This software will track how the athlete or the player is moving while doing the sports activity, and any alterations in this can be done if there is any faulty biomechanical movement. Let's discuss about biomechanical modeling. Biomechanical modeling has become very popular in the area of sports biomechanics. It not only helps in understanding the kinematics of the human body, but also helps in measuring the forces inside the human body. Now let's look into the risk factors for sports injuries. It is divided into internal factors and external factors. Internal factors like the age of the individual, biological gender of the individual, body composition, general health of the athlete, physical fitness, anatomy, skill level, psychological factors belong to the internal factors. External factors like the sports factors, the protective equipment, and the environment in which the player is playing. Now let's look into the inflammatory response to an injury, the basic pathology. Now this is ideally said to be the first phase of healing. An injury can trigger an acute or chronic inflammatory response, and the purpose of inflammation we all know is defense mechanism. Inflammation helps to control the effects of the injury, and it helps the injured tissue to return to its normal state. So we'll look into the brief description of events in inflammation. Firstly, acute inflammation. Like you all know, whenever there is an injury, you'll have release of all the inflammatory mediators pertaining to the acute inflammation. So you'll have all the histamines and neutrophils coming into action. And along with this, we'll also see the signs of inflammation. And as the inflammation continues, generally heals the body or the injury. Now let's look into the events in chronic inflammation. Chronic inflammation continues for several months to several years, whereas on the contrast, acute inflammation lasts for very few days or 1 week. Now the cells of chronic inflammation are macrophages, lymphocytes, and plasma cells. Now the extent of chronic inflammation is influenced by the cause of injury as well as the body's ability to repair and control the damage. Now let's look into the healing process. You'll have stages of healing. The 4 stages of healing are inflammatory phase, proliferative phase, remodeling, and healing. In the phase of inflammation, we have just discussed previously that inflammation can be acute or chronic, and the purpose of inflammation is to control the effects of the injury and to return the injured tissue to its normal state. We have discussed the acute and the chronic inflammatory changes in the previous. So we have seen the changes in inflammation that happen in the healing process. Now let's discuss about the stage 2, which is the proliferation phase. Now in this phase, you will see tissue repair that can start once the inflammation ceases, and this phase basically consists of 2 actions. A, fibroplasia, in which the fibrous material production happens, and B, which is called as angiogenesis, where you would see the new blood vessel formation. So proliferation phase is more like the phase of division, where the fibrous tissue tends to divide and spread, and also there is angiogenesis. So let's see what are the physiological events in this phase. You will tend to see capillary buds which form. You will tend to see capillary buds which form and grow towards the injured area. And we will also see granulation tissue which is created by the capillary loops initiating the blood flow. Followed by this, you will also see phagocytic activity by the specialized WBC cells. And you will also see lymphatic vessels which create a new drainage system. And you will also see fibroblasts which tend to contract the wound, pulling the edges towards each other. So once the fibroblastic activity starts, the wound tends to contract. So the size of the wound would reduce, so that the surface area of the wound would be reduced, and that would aid in healing process. Now this is the phase of proliferation, and in this image you can clearly see the angiogenesis, which is formation of new blood vessels, and you are also seeing the re-epithelialization and the formation of granulation tissue, which is a very important step in healing. Now the stage 3 of the healing process, which is remodeling. Now this particular phase lasts for a period of 3 weeks to 12 months and might overlap with the recovery phase as well, that is the last phase of healing. What are the aims of remodeling? The aims of remodeling are to decrease the wound size, to increase the scar strength, and also to alter the direction of the fibers. Now, let us see the physiological changes that happen in remodeling. In remodeling, the physiological changes are as follows. You would have contraction of the granulation tissue. The fibroblasts form intercellular bonds. So, once the fibroblasts form intercellular bonds, that would strengthen the wound surface and aid in quicker healing. And you would also have formation of cross bonds, the formation of cross bonds between the cells, and that would intensify the strength of the collagen. And then you will also see continuous turnover of the collagen, and the type 3 collagen is replaced by type 1 collagen. Now, this is a very crucial step in remodeling, that is the conversion of type 3 collagen into type 1 collagen. Then the last phase of healing process, which is healing. It is also called as recovery phase. So, there is a phase in this recovery phase which is called as lag phase. The main important concept of lag phase is edema control and resolving the pain. These are the two goals during the lag phase. But one thing that you need to understand is healing begins immediately, but collagen is generally not laid down until the 5th day after the injury. So, you need to wait for 5 days post injury for the lag phase or for the healing to begin. And also in the healing phase, we would see tissue mobilization, which is focused on realigning the collagen fibers, which can begin once the collagen is laid down, and hence the collagen aids in wound healing. Followed by this, you would also see something called as mechanical loading. Mechanical loading is nothing but there is a direction in which the collagen fibers are formed, and this synthesis of the collagen fibers would change the direction of the collagen fibers. Tissue mobilization focused on realigning the collagen fibers can begin once the collagen synthesis has been initiated, and mild stress during this stage is called as mechanical loading. Mechanical loading is necessary to stimulate collagen fiber alignment. Tissue mobilization focused on realigning the collagen fibers is a very crucial step of healing. Along with this, mechanical loading is necessary to stimulate the collagen fiber alignment. So, during the healing process, when you keep doing some mechanical loading, that would align the collagen fibers accordingly. Now, let us look into the anatomical regional sports injuries, that is sports injuries as per the human anatomy. Now, let us see sports injuries of the upper extremity. We will start off with shoulder injuries. The first commonest shoulder injury is rotator interval. Now, the rotator interval of the shoulder refers to the interspace between supraspinatus and subscapularis tendons through which courses the long head of biceps tendon. So, it is like a triangle, okay, and through this you would see, or the passage through which you would see the passage of the long head of the biceps tendon. Now, let us look into the basic anatomy of rotator interval. The borders of this rotator interval medially is done by the coracoid process. The superior border is done by supraspinatus tendon, and inferiorly it is by tendon to subscapularis. So, these are the borders of the rotator interval. The clinical importance of rotator interval. A defect in this particular rotator interval has been associated with recurrent anterior-inferior and multidirectional instability of the joint. The second commonest injury of the shoulder joint is rotator cuff injury. Rotator cuff injuries are common especially above the age of 60 and have an effect not only on the shoulder function but also on the overall health status. Coming to the pathology of rotator cuff injury, you will have extrinsic factors which cause impingement and also the acromial shape which alters the pathology. Intrinsic factors like microtrauma, age-related degeneration, oxidative stress and apoptosis affect the pathology of this particular injury. The overall incidence of full thickness tears in the general population ranges between 7% and 27%, and that of the partial thickness tears between 13% to 37%. And not all persons who suffer with rotator cuff injury are symptomatic. The other important aspect of shoulder injury is shoulder dislocations. The shoulder can be dislocated anteriorly or posteriorly. Anterior shoulder dislocation, firstly. 96% of all the shoulder dislocations are of anterior type, and it is mainly because of trauma. The dislocation of the shoulder joint happens due to a disruption in the structures like glenohumeral ligaments that keep the humerus in position. And the injury is caused by the arm being positioned in an excessive amount of abduction and external rotation, like you are seeing in the image. So the arm in the image is abducted and it is externally rotated, making the person prone for an anterior dislocation of the shoulder. Coming to the clinical features of this anterior shoulder dislocation, the arm is held in abducted and in an externally rotated position. There is loss of normal contour of the deltoid and acromion process. You will have the humeral head which is palpable anteriorly. All the movements are limited and they are painful of the affected joint. There is a palpable fullness below the coracoid process and towards the axilla. You will have a possible damage of the rotator cuff musculature and the bone. And along with this, you will also have peripheral nerve injuries which are common due to the traction of the brachial plexus. Following this, you would have posterior dislocation, which is not as common as the anterior dislocation. What are the causes of this posterior dislocation? It can be convulsive disorders, the most common cause in adults, often bilateral, or it can be electrocution, road trauma. Now, typically the humeral head is forced posteriorly in internal rotation while the arm is abducted. So here the arm is abducted and having an internal rotation. Clinical features of posterior shoulder dislocation. Here the arm is abducted and it is in an internal rotation position. It may or may not lose the deltoid contour. Tear of subscapularis muscle can happen. And this is the image which shows the posterior dislocation. The arm is abducted and it is internally rotated. How do you diagnose this particular injury? You can go with a simple X-ray, and if you are seeing on the image over there clearly, you can understand how the shoulder normally is presented and how the anterior dislocation of the shoulder is presented in the X-ray. CT and MRI are often needed to assess for the presence of subtle fractures of the glenoid rim or ligamentous or tendinous injuries. These are few images of the anterior and posterior dislocation in comparison with the normal shoulder joint. Coming to the treatment aspect, you can do closed reduction under general anesthesia. Along with this, you can go with symptomatic homeopathic treatment. Like on field, if there is a shoulder dislocation, to relieve the pain, you can go with homeopathic medicines. Probably arnica is the first grade of choice in such conditions, which will help in immense relief of the pain. Next, elbow injuries. Movements like throwing, pushing, opposing and gripping can all lead to significant elbow stress. Common elbow sports injuries like tennis elbow, elbow dislocation, golfer's elbow and ulnar collateral ligament injuries can happen. Tennis elbow is also called as lateral epicondylitis, and the cause is excessive use of the wrist extensor musculature. It is characterized by pain in the area where the common extensor muscles meet the lateral humeral epicondyle. Initially, analgesics like arnica, Rustox can usually help in relieving the pain, but if this continues, if the injury turns chronic, then it might need a surgical intervention. Golfer's elbow. It's also called as medial epicondylitis. The cause is repetitive valgus stress placed on the medial elbow soft tissues. Medial epicondylitis is characterized by pain and tenderness of the flexor pronator tendinous origin, which have severe pain at the medial epicondyle of the elbow joint. Homeo remedies for elbow injuries. Prominently, these are the remedies which help in relieving pain in elbow injuries. Remedies like Plumbomet, Radium bromatum, Rustox, all in 30 potencies give very good relief in elbow injuries. The medial ulnar collateral ligament injury, which is not as common as the other elbow injuries. This particular injury happens via repetitive valgus stress placed on the joint, which can lead to microtraumatic injury and valgus instability. And the diagnosis of the elbow joint basically are done using X-ray of the affected part, and CT and MRI help in studying the soft tissues of the involved joint. Coming to the wrist and finger injuries, approximately 25% of all sports related injuries involve the hand and wrist. Now, if managed properly, most athletes can expect their injury to heal without any significant long-term disability. So if the biomechanics are corrected, it will make the person less prone to the injury. So the commonest injuries in wrist are wrist fractures, like scaphoid fracture. Scaphoid fracture is a hyperextension wrist injury often occurring in a pronated, radially deviated hand. Common aspect of the wrist finger injuries are radial sided injuries, which may be due to articular degeneration. Ulnar sided injuries, like the extensor carpi ulnar injury or the hook of hamate fracture and ulnar abutment. Now, fall onto an outstretched hand with the thumb abducted causes an extremely common thumb injury, ulnar collateral ligament tear injury. These injuries basically are seen in basketball, skiing and football. Finger injuries like mallet finger, MCP fractures, that is metacarpophalangeal joint fractures, which are common in football, lacrosse and hockey. Along with these, you can also have extensor and flexor tendon injuries. You can also have pulley ruptures in mountain climbers, rupture of A2 and A4 component of the middle and ring fingers. Now let's discuss about head and neck injuries. So the first part of head injuries, the most common catastrophic sports injury is one that affects the head and neck, and it is also the leading cause of death in many athletes and many sports. So let's see head injuries. The commonest injuries that can happen to the head are intracranial hemorrhage, which is the leading cause of head injury death in sports, making rapid initial assessment and appropriate follow-up, which is mandatory after a head injury. And the second commonest head injury is concussion, which is very common in athletic head injuries, especially this can be seen in kids because they have a larger head when compared to the body. And along with this, we would also see a diffuse cerebral swelling, which is another serious condition which may be found in children or in adolescents age group. And there is something called as second impact syndrome, which is a major and a fatal condition. And along with this, we would also see something called as second impact syndrome, which is a major concern because this particular condition is fatal in adult athletes. So second impact syndrome is nothing but a second injury to the head before the first one has actually healed. So it can be fatal, and that is the reason why such injuries are very, very serious. Neck injuries, which are very, very crucial again in sports injuries, can have severe consequences, especially when it comes to fracture or a broken vertebrae. Neck strain and contusions also are very prevalent. The primary causes of most of the neck injuries include abrupt rotation of the neck, severe falls, direct impact on the neck, and instances of concussion. Whiplash injuries. These injuries occur when the neck undergoes a sudden flexion and or extension, typically resulting from a blow to the back of the athlete during contact sports like wrestling. And the symptoms are neck pain, stiffness and limited mobility. And the treatment for this particular aspect is that is rest, icing it, compression, elevation and referral of the case. Wry neck or torticollis is a sudden rotation of the head in contact sports, or it can be a fall that results in a sudden twist in the neck, a direct blow to the head causing sudden twisting. And the clinical features are pain and stiffness, loss of motion, and the neck may become stuck or frozen in one position. In head and neck injuries, we would also have injuries of the teeth, a fractured, displaced or knocked out teeth, and these teeth injuries may occur alongside other head neck injuries like concussions or bruises. Along with this, we will also see eye injuries, which are very common in sports like basketball, hockey, cricket. So far we saw the eye injuries. Now let's look into the ear injuries. Injuries to the ear can occur due to various factors such as direct trauma from the objects like balls, pucks, sticks or blows in the boxing. Along with these injuries, Infections like swimmer's ear, which the swimmers are usually prone to, can also lead to ear injuries. Apart from these, the ear can also be prone to injuries like cut, lacerations, bruises and swellings, which can affect the ear and the functioning of the ear. And we all know how important ear is as a special sense in sports. Without a hearing function, an athlete cannot play sports, which we all know that. Now let us look into the spinal injuries, especially at the cervical spine and the lumbar spine. Firstly, let us discuss about cervical spine injuries. The common injuries happening to the cervical spine are cervical strains and sprains, which is highly common in contact sports like wrestling. Along with these, we would also see brachial plexus injury, and this particular injury is more common in football, because when the footballer tends to do a header, they are prone to injure their neck and also the head. Apart from these injuries, we would also see disc injuries to the cervical spine, causing a compression of the disc and hence leading to radiculopathy. Now let us discuss about lumbar spine injuries. The common injuries happening to the lumbar spine are lumbar strains and sprains, and these injuries like strains and sprains happen due to weightlifting, overstretching, etc. Along with the above injury, we would also see something called as lumbar disc herniation, and this usually happens when the weightlifter probably tends to overlift the weight, and that might cause a disc herniation where the disc can bulge out from its perimeter or from its circumference. Followed by this, we would also see some common lumbar injuries like spondylosis, which is also called as lumbar spondylosis, and spondylolisthesis, in which one disc moves over the other. Coming to groin injuries, the incidence of this groin injuries is 0.5 to 6.2%, which is very rare, and the pathology of hip joint is most common reason for the groin pain, and other causes can be ligamentum teres rupture, chondral rupture, stress fractures, etc. Now coming to the chest and abdominal injuries. Common chest injuries can be rib fractures, lung contusions, pneumothorax, commotio cordis, which is nothing but a rare but potentially fatal disruption of the heart rhythm caused by a blow to the chest directly over the heart region or the mediastinum. Common abdominal injuries can involve organs like spleen, kidney, and can cause hernia. Lower extremities injuries. It can have ankle sprains, knee ligament tears, meniscal injuries, patellar tendinitis, bursitis, strains of the hamstrings, Achilles tendinitis, stress fractures, and plantar fasciitis. Now, among all these lower extremities injuries, the commonest injury is ACL tear, that is anterior cruciate ligament tear. Let us see the risk factors for sports injuries in the young. The risk factors are: children usually have a larger surface area to the mass ratio, making them prone to a lot of injuries. Along with this, children also have larger heads proportionately, making them prone to a lot of head injuries and neck injuries. And children may be too small for the protective equipment. So, all sports needs a protective equipment, and this protective equipment would protect the sports person from getting injured, and few children may not fit in for the protective equipment for the particular sport, and if it happens, the child is prone to injuries. Along with this, the other risk factor for injuries in the young is the growing cartilage. This growing cartilage may be more vulnerable to stresses. Growing cartilage may be more vulnerable to the stresses, making the individual sports. Growing cartilage, which is very soft, may make the children prone to word injuries. So, the growing cartilage is very soft. Due to the soft nature of the growing cartilage, that particular sports person is prone to a lot of cartilage injuries like chondromalacia, and children may not have the complex motor skills which are needed for certain sports, and these skills might be attained only after puberty. making the children prone to injuries. Children may not have the complex motor skills to perform the activity of the sport, which might make them prone to injuries. So, proper biomechanics along with proper training can help reduce sports injuries in the young. And the most common injuries in the young people can be contusions and strains. And along with this, there is something called as non-traumatic knee pain, which is one of the most commonest complaints in the young athlete. And this can be because of the growing cartilage. Coming to adventure sports injuries. Adventure sports injuries. We all like adventures, don't we? Now let's see what are the common sports injuries in adventures. Skydiving. Who doesn't like skydiving? But 71% of fatalities occur due to human error in opening the parachute. Now, once the skydiver has dived into the air, they need to open the parachute, and if there is a lack of opening of the parachute, or if there is a mistiming in the opening of the parachute, the skydiver can be no more. The next adventure sport injury can happen while doing kite surfing, and the main reason for the injury in this particular adventure sport is mislanding a jump in flat water or close to the beach, resulting in a lower limb trauma and loss of the control of the kite. Blunt trauma due to inability to release the kite from the harness can also lead to major injuries. Now, kayaking, another adventure sport, and the most common injuries in kayaking can be shoulder dislocation alongside sprains and tendinitis. Also, mountain biking. The commonest injuries in mountain biking can be clavicular injuries, spinal cord damage. Next, we will be looking into motor sports injuries. Motor sports injuries. Now, who doesn't like going fast on the roads? Don't we? But motorsport is a different ball game altogether. Motorsport vehicles usually they are well equipped, and the rider or the driver has all the protective equipment, but still there can be fatalities, there can be major injuries in motorsports injuries. Motorsports vehicles are not only having a high technology, they also have good safety constructions as well as safety precautions. In the event of an accident, the kinetic energy of the motion of the vehicle will be absorbed by the driver or the rider, and this absorption of the energy is the basic component of injury. So, the more fast you go, the more serious the injury can be. Now, let us see the common injuries that can happen in motorsport injuries. The common motorsport injuries can be head injury, a spinal trauma, thoracic injuries, abdominal trauma, extremity and pelvic trauma, and also burns. Along with these, another important aspect of the motorsport injury is the burns, which can happen accidentally. So, the initial management of burns can be done by securing the airway, improving the oxygen flow, using special burn dressing, giving analgesics, fluid replacement if there is dehydration, and also determining the severity of the burn by using the rule of 9. Coming to the diagnostic tools in sports injuries. Sports injuries can be diagnosed using X-rays, MRIs. MRIs gives a detailed study of the superficial and deeper soft tissues like ligaments, tendons, etc. CT scan helps to visualize the bones and soft tissues, and along with the another diagnostic tool is ultrasonography and also musculoskeletal ultrasonography, which will help us understand the nature of the muscle and the internal organs. And the other important aspect of the diagnosis of the sports injuries is complete blood picture. Along with these, you can also go with electromyography, which will help us understand the electrical activity of the muscles. Coming to the preventative measures of the sports injuries, which is very crucial for all the athletes at all levels. The performance of an athlete can be affected in three major categories. It can be physiological affection, a psychological affection, or a biomechanical affection. Among these three, biomechanical factors have a profound effect on how and why the athlete is getting injured. Van Mechelen proposed and developed the 4-step model for injury prevention in sports by application of the biomechanics. He said, in the step 1, establish the extent of the injury problem, and in the step 2, establish the etiology and mechanism of injury, and in step 3, you need to introduce the preventive measures. In step 4, assess the effectiveness by repeating the step 1, and then continue all the steps so that you can prevent the injury in a particular athlete. TRIP, which is nothing but translating research into injury prevention practice framework, is an extension of the Van Mechelen model, which includes two additional aspects, that is understanding of the real world for which the specific intervention is being developed and the evaluation of this intervention in a real world setting. The factors to be considered while framing an injury prevention. Factors like the sports participants' age group, the level of play, the type of sport, and the organizational structure in which original intervention was evaluated. All these factors should be considered for framing a good injury prevention program. Now, areas to focus in a sports injury prevention program are training strategies, modification of sports rules and changing policies, and also equipment recommendations. Training strategies like proper training and technique, learning the correct form and cross training, warm up and cool down, which is very important before and after the sport, strength and flexibility training, proper nutrition and hydration to avoid fatigue. All these are very important to prevent sports injuries. Along with these, neuromuscular training is very important. Now, these programs are often led by the coach or trainer after a comprehensive training session by a physiotherapist. Now, many studies show that neuromuscular injury prevention programs are very important to reduce the risk of injury. A greater preventative effect can be achieved when the neuromuscular training focuses on proprioception,